sometimes the patients in ICU, even though they're on the ventilators and on maximum support, we still can't get their oxygen levels up. Their oxygen levels are still really low. So what we found helps is turning them over onto their front, so they're laying on their stomach, and they can be in that position for up to 16 hours, sometimes more, to try and help their lungs and to get more oxygen into them. And then it takes about 4 or 5 of us to do that, to turn them over safely. And then we have to, once their oxygen levels are better, we turn them back onto their backs and see how they do. And this patient was doing quite well. Her oxygen levels remained good even when we turned her onto her back. But it's very busy in here at the moment. There's not enough staff to look after these patients. Normally we would work 1-to-1. At the moment we have at least 2 patients, sometimes more, to 1 nurse. And it's very busy, and it's quite hard to get the staff to be able to do things like this. But it's hard for the staff as well, where we're split over all different areas at the moment because there's not enough rooms in intensive care, so we're having to move patients to other areas, and getting enough equipment, and it's really tough going at the moment on the staff and the patients.
Me llamo Marisol, me trabalho na intensive care, me 25 anos. E wave de Covid aqui tá muito doloroso. Paciente não tá morrendo, se não família rondoi não. Nós está fazendo nos best, nos mandando a cortico. Nós está pedindo você please, queda casa. Escuta lo que tá bisa, não vai de aglomeração. Viste você na máscara, hasi você na best para a infecção que por, e vírus que por barra. Nós está roga você não de coração de Kuido Intensivo. Corre você na família não, corre riba nós, laga nós corre riba nosso pueblo. Mas danke.